Good morning, everyone. I hope you're all doing well on this beautiful, cool Friday morning. My name is Nairi Toussaint, and I'm the Director of College and Career Readiness for the Waterbury Public Schools. I'm so happy you can all join us for this exciting Medical and Healthcare Career Symposium. I would like to thank Dr. Ruffin, Superintendent of Waterbury Schools, Judge Maurice Mosley, founder of Granville Academy, and Kieran Harvey, Vice President of the Board of Ed, for their support of this symposium. So at this time, I would like to introduce Dr. Ruffin.
Thank you very much, Ms. Toussaint, and welcome everyone. I'm so excited about being here with you today. When Judge Mosley spoke with me and Ms. Harvey several weeks ago, it was with the excitement and possibility of having our physicians join us and to talk with our students about a very important career, but also interestingly, a career that is very much sought after by students in Waterbury Public Schools. And just the evolving state of the medical world at this point is exciting to me. And to be joined this morning by Dr. Sinclair Mcbride, Dr. Churchwell, it's just exciting to know that my students, and there are over 200 of them that are live here with you today, have an opportunity to learn about the profession from the professionals who can really inspire our students to greatness. So thank you very much. I want to hear from you more than I want to hear about me right now. So I will turn that over to back to Ms. Toussaint and probably Judge Mosley and others. But thank you, first of all, for being here and serving on the panel. And thanks to all of the students, the teachers and staff and principals who've made this possible for our students to get inspired this morning.
All right, thank you, Dr. Ruffin. The next individual I would like to introduce to also share his thoughts with us, Judge Maurice Mosley.
Thank you very much. First of all, I want to thank Dr. Ruffin and her trusted assistant, Ms. Toussaint, and the entire school department for collaborating with us on this exciting and informative symposium that has the potential for changing the students' lives in the city of Waterbury. For the last 8 years, I've been a juvenile court judge in New Haven and in Waterbury, but today I'm here in a different capacity. I'm here in the capacity as president of the Granville Academy. And for the last 30 years, along with our partners, the Waterbury chapter of the Links, which are a dynamic group of females of color, we've been growing doctors, lawyers, engineers. We're taking students like you, and now they're all over the country with important positions serving the community. 90% of the youngsters that join Granville go on to be professionals. And we've been doing it for the last 30 years. Today, we're kicking off a different program. There's been a pandemic and health issues. So we are figuratively building a school to medical and health career pipeline where we're going to expose youngsters in the city of Waterbury to exciting and lucrative careers. It's estimated that in the next 8 years, there are going to be over or almost 2 million new jobs in the health career field. And those jobs are going to pay 1.5 times the median income of other professions. In short, if you go into those fields, you'll be making $4,000 to $5,000 to $6,000 more a month. It's a ticket to the middle class. Now, today, we have a dream team of presenters, 2 outstanding individuals that look just like you. One grew up in Nashville, Tennessee, which is home to the civil rights movement and John Lewis and the discriminations, and also Dr. Sinclair Mcbride, who grew up in Waterbury, the Long Hill area, a Granville Academy alumnus, Grace Baptist Church, walked the same streets that you walk, and they look just like you, and they're going to be talking about all the various jobs in the healthcare field. Now, the reason why we are developing this pipeline is not so much for the students to make a lot of money, but you will do that. But there's some major health issues in our country. Dr. Fauci, who leads the COVID response, told Emory graduates 3 weeks ago, it's undeniable. Racism and discrimination have led to unacceptable health disparities in terms of Blacks, Hispanics, and Native Americans. Dr. David Williams from Harvard says that 200 Blacks die each day because of the way they're treated in the healthcare system. Also, Dana Matthews, who wrote the book Just Medicine, says that over 84,000 Blacks, Hispanics, and Native Indians die every year because of mistreatment in the healthcare system. The solution is you. God has given all of you a gift inside of you. Some of you have the gift to solve the problem of asthma, sickle cell anemia. And we have professionals from all over the country that are willing to come in and work with you youngsters so you become part of the healthcare system. And also, we don't want you just to be worker bees. We want you to be like Dr. Sinclair McBride and Dr. Churchwell. We want you to be involved in policy making, be the president of Waterbury Hospital, be the president of St. Mary's Hospital, be the employer, give the orders. In closing, there's going to be a survey. If you're interested in working with us, we want you to fill out that survey, say, yes, you want to be a part of the pipeline. We're willing to come in, whether it's in the evening, Saturdays, Sundays, or during the school day to help you. We have professionals from all over the country that are willing to do that. In closing, Woody Allen said, one of the keys of life is 90% of life, 90% is just showing up. And I'll add the next part, you got to work hard. Thank you very much.
All right, thank you, Judge Mosley. This symposium has been a long time coming. It was scheduled for Monday. However, due to the weather having its own plans, we had to postpone until today. Therefore, two of the doctors who were originally on this panel are unable to be with us, but that's okay because we still have two amazing doctors with us today, as Judge Mosley said. This is an opportunity for everyone to just sit back, listen, and ask any questions that you may have of the doctors. So with us today, we have Dr. Keith Churchwell and Dr. Kenesha Sinclair McBride. Dr. Churchwell is the president of Yale New Haven Hospital and associate clinical professor at the Yale School of Medicine. He was born and raised in Nashville, Tennessee. He obtained his undergraduate degree from Harvard University and medical degree from Washington University School of Medicine. He has held many positions in the medical field and has experience with heart and vascular services, transplantation services, radiology, and even worked in a private cardiology practice. Dr. Churchwell brings a wealth of knowledge, experience, and involved in a variety of areas in the medical community. Next, we have Dr. Sinclair McBride, who is an attending psychologist at Boston Children's Hospital and associate training director of the psychology internship program. She is assistant professor of psychology at Harvard Medical School. Dr. Sinclair McBride was born and raised right here in Waterbury in the North End section where her extended family still lives. She was also a member of Granville Academy, as Judge Mosley said. She received an undergraduate degree in psychology from Yale University and her master's and PhD in clinical psychology from Vanderbilt University. She's a licensed psychologist in the state of Massachusetts to children, adolescents, and families. She conducts research on specific disorders in children and adolescents, and her goal of the program is to provide evidence-based behavioral health care to at-risk and minority youth. Dr. Sinclair McBride is the author of numerous articles and a contributing author to chapters in the Handbook of Pediatric Psychological Screening and Assessment in Primary Care and the Nelson Textbook of Pediatrics. Ooh, that was a mouthful, but that's all great stuff. Thank you both for being with us today. At this time, I'm going to turn it over to you, Dr. Churchwell.
Thank you. I'm not sure who she just introduced. Maybe I need to get someone else to actually do this talk, but I'll do the best I can. I'm going to share slides if that's okay with everybody, and hopefully not take up too much time because I know Dr. McBride has got a lot more to say than I do. It's funny. I wrote down that our degrees of connection, it's a small world. I feel like Kevin Bacon. Boston Children's, and Yale and Vanderbilt all at the same time. That's amazing. We need to talk as we go forward. Yes.
Definitely.
All right. So great. So thanks for the opportunity to talk this morning, and I hope that this will be helpful to our audience. I know you're getting close to the end of the school year. I think that's correct. I'm not really sure. I don't have any children in the Connecticut in the school system here, so I'm actually a little bit unclear exactly in terms of how long the school year is, but I think that's where we are. But I thought I'd take the opportunity just to tell you a little bit about myself, how I got to where I am at this point, and just some points to consider as you think about your journey towards a professional career, and hopefully for a professional career in the health field. So I always lead with any of my talks with the vision, mission, and value statement from Yale New Haven Health. The reason for that is that it actually has always been in my experience here. I've been now actually in Connecticut for the past 6 years. Part of the North Star of how I think about the development of care, the opportunity that always presents itself to help our fellow individuals across the state, and especially in the area of Greater New Haven, in thinking about the delivery of care, our values, our mission, and our vision, and that actually is the way that we think about each and every decision that we should be making in regards to the clinical environment, our financial environment, and administrative environment at Yale New Haven Health. So I always started to talk actually with my parents. So these two individuals, the one sitting is my father, Robert Churchwell Sr., and my mother, Mary Churchwell. Both unfortunately have passed now, but they were the guiding lights for all the kids, 5 children, in terms of our overall development, and a pathway in terms of what happened at home and also in our outside the home of how we think about our day-to-day work and our day-to-day lives. My father was the first African-American journalist for a major metropolitan newspaper in the South, the Nashville Banner, and he worked there for over 30 years. My mother was was at home, but then after the birth of myself and my twin brother, Kevin, who Dr. Mcbride knows very well, decided to go back to school, finish her degree at Tennessee State University, and then get a master's at Peabody College, and then taught school for over 30 years. They invested time and energy every single day in terms of our overall development in regards to our education, our outside activities, and our spiritual growth, and our growth as young folks. And that made obviously a huge difference upon us. We think about them every single day in terms of the lessons that we learned from them, and also the opportunity to actually make them proud of the work that we do. I also want to touch on, these are my brothers and sisters. This is not the right order, so I'll tell you a bit about them. The oldest, who is actually the second from my left, which I think is also your left, with the gray hair, is my senior brother. That's Robert Churchwell Jr. He's a retired school principal, actually in Nashville. To the far right is my older brother, 8 years older. He's Andre Churchwell. Andre is a cardiologist. He is the Levi Watkins Chair of Cardiovascular Medicine, and Biomedical Engineering at Vanderbilt, and also is the Vice Chancellor of Diversity for Vanderbilt University at this particular time. And right in the middle is the middle sister, my sister Marisa Churchwell Smith, who works on the Vanderbilt campus and works with hearing impaired children with her degree in audiology. And then to the far left is my identical twin brother, Kevin Churchwell. Kevin is a pediatrician by his training, pediatric critical care. But at this point, and this is the connection with Dr. Mcbride, he is the CEO and president of Boston Children's Hospital. So in a great respect, in a great sense, I'm the runt of the family in regards to the overall achievements and what has occurred within the Churchwell brood from Nashville, Tennessee. But it really speaks to the investment of time and energy and the thoughts that my parents actually instilled in us as we were growing up, and gave us the opportunity to actually grow in a way that has helped fulfill, I think, their dreams in us, and an opportunity to fulfill our own dreams. So just a bit about myself. This is my 35th anniversary picture from Harvard University. I graduated from Harvard in 1983 with a degree in biology. I decided actually to go to Harvard when I was about in the 9th grade. I was asked the question in an economics class, what profession did I want to attain as an adult? This was actually a class project. I decided at that time that I actually wanted to be a physician. And in that, I thought the best pathway to actually get there was to go to Harvard University and then go from there. So at that point, I started to set my sights about how to accomplish those overall goals. And I think that's key in terms of how you should be thinking about your work at this particular time, and start writing down those goals about what you want to attain, and sort of thinking through how you actually want to get those particular goals. So becoming a physician was key for me. And I decided to go to the Washington University School of Medicine, which is in St. Louis, Missouri. This is a picture of the campus. Washu is one of the largest medical schools and private medical schools in the country, and is actually already ranked in the top 5 in terms of their overall research capability and intellectual prowess. Washu was a great opportunity for me in terms of instilling in me the number one, that this was the right decision for me to make to become a physician. And number 2, helping me make the decision the type of physician that I wanted to become. In the second year of medical school, you take a number of classes. The most important are actually physiology, and the most important from my perspective is pathophysiology, which is actually the evaluation of disease, of what happens to the body and why does it go wrong. And in that evaluation, we got to the heart and to the cardiovascular system. And at that point, it became very evident to me that I wanted to be a cardiologist. So that at that point, I started to set my sights on how to attain that goal, to become a clinical cardiologist and possibly an academic cardiologist, and what that meant, what I needed to do to evaluate and understand the cardiovascular system, and also to strive as best I can within the medical school environment, and also think about where I wanted to get training from, and to move forward in the right direction to become actually an internal medicine resident and then a cardiologist. And then from there, I went to Atlanta to Emory University School of Medicine and its affiliated hospitals, and did my residency and then my fellowship training. And in that time, I also became a chief resident. I was a chief resident at Grady Memorial Hospital, which is actually the head resident for a year for all of the residents and interns and fellows who actually are part of the training program at Emory. That was important because of the learnings from a clinical standpoint and the education about medicine and all that it entailed, but also started giving me the grounding in leadership and also how to think about the administration of medicine in a unique way and its overall importance in our day-to-day lives. So from there, I actually spent time as a clinical cardiologist and had the great opportunity to work with my older brother in Nashville, Tennessee, who had been at Emory for a number of years, but had gone into private practice cardiology about 5 years before I left Emory. We worked together for over 20 years, and I think that was a unique opportunity to work with your brother, who actually thinks he's your father, but that's another story in terms of the overall relationship. But in that, it was a great learning time for me, and also, and to be honest, a great mentorship. And with someone who actually is really one of the top cardiologists in this country. But I show this picture because this is actually a blazer designed by him for the Vanderbilt Heart and Vascular Institute. I became a Vanderbilt faculty member in 1998 and full-time faculty in 2006. And in that period of time, became an associate professor of medicine and radiology, but also took a number of administrative roles within the Heart and Vascular Institute, which culminated in my becoming the executive director and chief medical officer for the Vanderbilt Heart and Vascular Institute for a number of years. In that, I had dual roles in the clinical work of cardiovascular medicine and as a nuclear cardiologist, because I also became the chief of cardiovascular imaging for the Institute, but also the day-to-day operations and development and the expansion of clinical services for the Heart Institute in Nashville and in the surrounding areas of Middle Tennessee and the greater area of Tennessee and actually 2 other states, and its overall growth. In that period of time, our institute grew from, in 1998, treating and taking care of 9,800 patients to the time I left in 2014, treating over 145,000 individuals with multiple resources and opportunities that went from day-to-day evaluation for general cardiology, but also the development of an expansive heart failure and transplant program that in last year, 6 years after I left, actually was the largest transplant program in the country, with doing well over 100 heart transplants at that particular time. So a area of maturation for me and growth and development as a clinician, as an individual, and also as an administrator. And that really has led to my position here at Yale New Haven Hospital. I show this picture, and this picture is actually speaks to my association with the American Heart Association. Part of my time as I became a cardiologist, I realized that this was actually very fulfilling to me, but there was actually an additional part in that, and working towards what I needed to do and work towards with the community at large, outside of Vanderbilt, and spoke to my capabilities as a cardiologist, but speaking to a more of a regional and a national need to address issues around the heart and cardiovascular medicine. So I joined the American Heart Association as a volunteer at that time. And in that time, I've actually had a number of positions with AHA, including president of their Southeastern affiliate and with the founders affiliate here and Eastern States affiliate, and also the National Executive Board, and at this particular point with the American Heart Association, and now also chair of the National Advocacy Committee for AHA. But also at that time, I became someone that they touched on to help lead their health equity evaluation and program, and then thinking through the issues of health disparities and their impact on overall total health, but also cardiovascular health, which led to the development of their health equity office, and also other opportunities for me to actually be on a larger stage to help us define the issues that surround all of our patients, especially in our Black and Brown communities, around cardiovascular health, identifying and illuminating the issues and thinking through solutions that we now have become even more prominent and prevalent in terms of our conversations around health. So what do I do at this particular point as the president of Yale New Haven Hospital? This slide in the upper right-hand slide is actually a slide on COVID. This is our COVID data over the last 15 months, and this has been a significant part of what my day-to-day work in taking care of a very sick and complex patient population, on top of a very large patient population who actually do not have COVID. At one point, we had over 471 patients who were COVID positive in our hospital in April of 2020. If you think of it that way, that made us the third largest hospital in the state of Connecticut, on top of actually being the largest hospital with over 1,500 beds in totality. But you also see in that blue line, which goes across from May of 2022, actually just last week, a significant population, a COVID population that has been with us since October of 2020 until now. And thankfully, because of vaccination and opportunity of social distancing and the use of mask wearing, we are actually in a much better state. But we still have a lot of work to do to actually to get us to herd immunity, and also to ensure that with the next exacerbation of this pandemic, we can actually control it very effectively. To the left is actually a paper that actually I was the first author on and the primary author on called "A Call to Action: Structural Racism as a Fundamental Driver of Health Disparities." This is actually work that I actually have been a part of and culminated in this paper with the American Heart Association, looking at health disparities and identifying the issues of structural racism as one of the fundamental drivers, and discussing it and thinking about solutions from AHA's perspective and from a more global perspective that we need to deal with from society's perspective, both in the health environment, but also in our political and also administrative needs. So I have, and because of that, there is an active conversation that thankfully I'm a part of, and helping to work and formulate ideas and also hopefully solutions to what is one of the knottier problems from a medical perspective, and how we treat patients actually in our communities that we live in, and to enhance their overall care and lead to better outcomes. And then the last at the bottom is actually just something from when I became the president that speaks to the opportunity that has presented itself in working towards taking care of, at times, over over 500,000 patients on a year's time at Yale New Haven Hospital, and joining them in developing their pathways of care to enhance their overall health, not only actually within the hospital itself, but also before they come to the hospital and leave the hospital. So it's a unique opportunity, and I have really enjoyed the time I've actually spent here in New Haven. So a few lessons learned in all this journey. Number one, school is incredibly important. And when you're in school, three things that actually I sort of kept paramount in terms of my thoughts in my time as from middle school all the way through college and medical school, but even in the schooling that has come after that. School is an opportunity to learn your craft, learn your subject matter, learn it in a way that actually it becomes part of your overall thinking, and you can use it as a tool to actually for advancement in your day-to-day work. You need to study in the work that you're doing, study to ensure that you're actually maximizing your capability from getting the most out of the work, and also from your grades, but also study in a way that actually expands you as a person. Don't be afraid to actually go outside of your comfort level of the things that you know, to work on and understanding things that you do not know. And also to observe yourself, observe others, to understand what is really part of the human condition, so that you can be more empathetic, that you can have the emotional capability to respond and to evaluate and to lead in areas that you may be unfamiliar with, but gain familiarity with, so that we can get to a better place. Understand that you have an opportunity to do something I think is incredibly important for all of us, that you can have an impact not only on yourself, but also those that surround you in a way that actually can be incredibly positive. And that should be part of your observation. Number two, find joy in your work. Do something that actually brings you true joy. And what I mean by that is that I get up every single morning really looking forward to coming to work. After I get past the fact that I have to get up so early in the morning and get the sleep out of my eyes, and actually after the shower, I really enjoy the work that I do. And that I think is incredibly important. You don't want to get into something that you do not enjoy doing. You need to find true joy in that work, true enjoyment in that work, because then you will always grow, be able to expand, and find it actually as a vehicle for you that is going to be life-affirming and life-enhancing for you. Three, learn things outside of your comfort zone. There are things that you have a capability and facility to learn and become expert at, and that's fantastic. But extend yourself. Be unafraid to actually go into fields, whether it be science in particularly, or other fields that you actually have unfamiliarity with, and also you may feel that you don't have expertise with, and you may think you may fail. Work towards actually understanding those limitations and expand those limitations for you. With that, you become a much more well-rounded individual, a much more capable to actually to respond not only to issues that actually are familiar to you, but also unfamiliar to you. Four, it'll take 10,000 hours to become great at what you do. Malcolm Gladwell's book Outliers actually has a wonderful chapter talking about the Beatles and how they became such a great band. It turns out that they actually worked in Germany for years and years, and no one knew who they were. But every single night, they actually played together. And in that time, it actually calculated about 10,000 hours before they became a great band and became well-known, and now actually internationally known, legendary. It's about 10,000 hours actually of work in terms of the subject matter that you have decided to actually become an expert in, that is going to allow you to be that particular expert in that. So I would say it's probably time to get started to accumulate those hours. And then last, I'm always have to ask, how can I help? How can you help? So in that conversation, my email is always available. Nyrese probably has it. If you have questions or thoughts or concerns or things that actually have come up that I can be helpful with, don't hesitate to reach out. And I always end any talk with what keeps me actually really sustained, and that is my wife, who's sitting to the lower right, And my daughter is actually now in Cambridge, England. She is actually finishing her master's here at the University of Cambridge in archaeology, studying the societies and the empires of the Akkadians, Sumerians, and Babylonians. Do not ask me what that means. Importantly, though, it is incredibly important to her. It is part of her life's work, and she's going to use this to actually think about the impact that she can make in the communities that we serve when she comes back after her PhD in the area of museum science and museum curation. So there are many pathways for us to make a contribution, and she has taken one that I think is unique and is one that I'm very excited about for her. So thank you, and I'm going to turn it over to Dr. Mcbride.
Thank you so much, Dr. Churchwell. I'm looking forward to talking a little bit more about our mutual connections at some point in the future. I'm going to share my slides. I'm really excited to talk to you guys today. All right, so everybody can see that? I'm looking for Nairi to nod. Thank you, Nairi. All right, so happy to be with you guys today. I have a couple of slides, but I like to give people an outline of what I'm going to talk about so you know what's going to happen. So here we go. So the first thing I'm going to do is talk a little bit about myself. I'm from Waterbury, like people have been saying, just like you guys are, and I went to Yale, and then I did many things beyond that. I'm going to talk about that. I'm going to talk about what a day in the life of a psychologist is. A lot of people don't know really what psychologists do, so I'll tell you guys a little bit about what I do. And then we're going to have a little bit of therapy in 5 minutes or less. You're all going to learn something today that you can use to help you feel better if you're ever having a hard time. Then we're going to talk about something that Dr. Churchwell was actually talking to you guys about, racial disparities. So there's a disparity, that means something is unfair based on race. And there are definitely disparities in physical and mental health. So we're going to talk a little bit about that. Then I'm going to talk to you about the most important thing, I think, is why we need more people of color in healthcare. This is so important. We need you guys, and I want to talk a little bit about that. I'm going to encourage you to dream big. I'm going to teach you a little bit about the different careers in mental health, and then what you need to do to prepare. And then we'll all have questions with myself and Dr. Churchwell. So this will be super fun. Okay, first, like I said, I'm from Waterbury, and I'm going to prove it to you right now. There is someone in this audience from Reed School who is the definition of Black girl magic. She is my little cousin, Amara Pylon, and I just wanted to shout her out today. Cousin Nisha is very proud of you. So after Waterbury, what did I do next? I went to Yale, and it was an incredible experience for so many different reasons. I met the mentors that helped me get into graduate school. I got to meet all kinds of people, take all kinds of interesting classes, even with famous people. I met my husband there. It was a great experience. And then, so one of the most important things I wanted to put up here was just my graduation from Yale picture. This is one of the most special pictures to me. It's with my late grandfather at my graduation. My family is super important to me, and I really appreciate the foundation that they laid for me. I know my mom is in the audience, so hi, Mom. So this picture is from my graduation from Vanderbilt. So after Yale, I went to graduate school, where I got my master's and PhD. So a secret thing that people don't always know about getting a PhD is that you don't have to pay for it sometimes. If you go to a place like Vanderbilt, they pay for it. They paid for my master's, they paid for my PhD, and they paid me. So when I was in grad school, I lived in a nice apartment with pools and stuff. So just something to keep in mind, grad school can be fun. After I graduated and wore the little funny hat, I did my internship at Boston Children's. That is the last thing you do to become a clinical psychologist. And then eventually I ended up working there. So now, you guys heard, I'm a psychologist at Children's. I'm one of the training directors for our internship program. So the same program that brought me to Boston, now I get to help be one of the directors of that. And then I also get to be an assistant professor of Harvard Medical School. So Attorney Mosley has been teasing me about how young I look. And fun fact, I probably am one of the youngest people to be an assistant professor in psychology. So he's right. So then, I've gotten to do so many cool things in this role. And one of the things I did recently that most impressed my nephew and my daughter was impressed too, is I got to be on TV, and I talked a lot about how trauma has impacted our community during COVID with all the different police brutality things that are coming on, has been happening. It was a really interesting and cool experience. And I have a YouTube, like I was on YouTube, which is like now the ultimate thing to my nephew that I've been on YouTube. Okay, so what do I do in a day? What does a psychologist do? So the first thing is kind of obvious. It's the thing that people think about when they think about psychologists. I provide therapy or counseling to kids, to teens, to young adults, to families. Another thing is I help families solve puzzles. If their kids are having a problem at home or at school, we try to figure out next steps to figure out how we can help them do better. I supervise students who are also learning how to provide therapy. I give lectures on mental health topics. I work on research with some of my dear friends because our goal is to figure out ways to get the best kind of mental health therapy to the most people. And then similarly, I work with some of my other friends at work to make sure that all kids that we see in our primary care department, so which is mostly Black and brown kids, make sure they get the highest quality care that they can. And then I'm also recently working on my business. I see patients outside of the hospital in private practice. I do speaking engagements. I have a website and social media, so I work on that stuff too. Okay, so now we're gonna do therapy in 5 minutes or less. So this is called Quick Calm. If you're ever nervous, you're ever worried, just try this. Take a deep breath, relax your muscles, because whenever people are nervous, they're like kind of like, ugh. And then close your eyes and imagine a fun or peaceful place. It's not gonna solve everything, but it's just gonna help you slow down a little bit. Another thing that I like to teach people is what to do if they're thinking badly about themselves or about a situation. For example, sometimes people have like a hard day with friends and they think no one likes me. So here's what you do. You think, what are the facts about the situation? For example, you probably have good friends, your family loves you. Then you think, what would you say to a friend? A lot of times it's easier for us to be nice to our friends than ourselves. So you think, what would you say? You'd say, that's not true. You have a lot of friends, people love you, that kind of thing. Then you think about how you can take your mind off that sad thought. So you might watch a TikTok video, do something else, just to kind of get your mind out of that headspace. So there you go. That's your quick therapy with me. All right, so now let's talk about health disparities. So like I said, a disparity is something that's unfair. There are racial disparities in healthcare in our country. One of the ones we've all been talking about a lot recently is the disparity in people passing away from COVID. As you look at that little slide, it shows you that Black people and Native American people and Hispanic people are dying at higher rates than everybody else. Another really sad one that's important is the fact that Black moms are more likely to pass away giving birth than white moms are. And so then one that is related to the stuff that I do is the fact that like not everybody who needs mental health care gets it, but even less minority kids do. So 31% of white children who need mental health care receive it, but only 13% of children from diverse backgrounds do. We need to change that. So this is why we need more people of color in healthcare. Like I just said, people from minority groups are less likely to receive mental health care. So Black and brown youth who are having troubles with their emotions or their behavior, they're more likely to be referred to juvenile justice than mental health care. Whereas other kids will be given recommendations to get access to people like me. Our Black and brown kids sometimes end up in juvenile justice when they're struggling. Black people often receive poorer quality mental health care and less access to culturally competent care. And then when we do have healthcare professionals of color, we're more likely to see patients of color, to serve in underserved areas, to do that hard work. And then my minority patients are generally more satisfied with their care. They're happier with what happens at their care if they have providers of different backgrounds of color. So these are super important reasons. When you put all that together, it's obvious that we need you guys. Okay, so this is the dream big part. What if you could achieve your goals, help your family, help your community, make a difference, make money, like Attorney Mosley was saying, right? A bachelor's degree is worth $2.8 million on average over your lifetime. And people who have a bachelor's degree earn 84% more than those with just a high school diploma. But for healthcare careers, you can add more to that. And you can. You totally can. That's the point of us all being here today, right? Is to talk about the fact that you all can do this too. So lots of people don't know about like, what are the different things in mental health care? We know that that people are doctors, but what are the other things that are about kind of what happens in your mind? So like I said, I'm a psychologist. There are also medical doctors who are psychiatrists, and they work often in hospitals, helping people to know what are the right medicines to take to feel better. Similarly, underneath them often works like psychiatric nurse practitioners and psychiatric registered nurses. And these are nurses who like specialize in helping people with mental health. And then on that row underneath, I have all the master's degree professions that work with us all to help with mental health care. Clinical social workers, mental health counselor, marriage and family therapists. And all these are opportunities to do things like therapy, like I've been talking about, to work in your community, that sort of thing. So there's so many different ways to be involved in mental health care. But I think the thing you notice that they all have in common, right, is that they involve graduate school. So if you're interested in any of these careers, take all the science classes you can in middle and high school, even if there are some that you don't like. Like, I didn't really like chemistry, but I took AP chemistry and I did well in it because I worked hard, but like that helped me understand lots of things so that when my colleagues who are doctors are talking about the medicines that my patients need to take, I understand because I like took all those classes, right? But then if you're interested in mental health, you take psychology, public health, or any other classes like that that are offered. Anything that's going to teach you about the mind, emotions, social problems, kids, anything like that. Then research to find out more about these careers. A thing that I've noticed is that on TikTok right now, there's lots of doctors who post like cool videos that talk about the work they do or like answer questions and stuff. So you can even like look on TikTok to research. And then volunteering is super important and something that colleges look at, something that graduate schools look at. It's an important thing to do just for your community. And if you do any of that stuff in child-focused places or mental health-focused places, community programs, all that kind of stuff, reach out to the people in these fields to learn more. You know, that's like, just like Dr. Churchwell is saying, you know, like I'm going to put my email at the end where I'm always available to talk to people about this stuff. And you're going to have a lot of opportunities to talk to more people through this program. So in college, the goal is to major in a science or psychology focused subject and get ready for graduate school. So get good grades, be a well-rounded student, have mentors who can help you do research so you can have a good application for graduate school. At the end of our event today, fill out the survey and sign up for the pipeline so you can have more opportunities to talk to doctors about what they do and other healthcare professionals. And you can always contact me. This is my my private practice email. I'm happy always to talk to you guys. I'll give it to Nairi so she has it too. And that's it for my slides. Thank you guys so much. I'm ready for us to have some question time.
All right, thank you, Dr. Churchwell and Dr. Sinclair Mcbride. We do have a number of questions for both of you. Let me back up first. For Dr. Sinclair Mcbride, let me ask you the two specific questions that are burning out there for you. Where did you go to school in Waterbury? Mm-hmm. And what was your psychology internship like? Okay,
so I went to a little Catholic school on Willow Street that does not exist anymore, St. Margaret's. And then I think when I was in 8th grade there, that's when I went to Granville. And then I went to another school that no longer is around, Chase Collegiate School. So that was what I did in Waterbury. And then in terms of internship is really interesting because you go from being a graduate student to like being somebody who works in a hospital. And like, you're there, you know, trying to get notes together, having all kinds of complicated patients, having people from all around the world that you know, places you've never been, and you're trying to help their families to help with emotional problems and behavior problems. I got really close with my other interns because we spent a lot of time together and we did a lot of new things together. It was hard work, but it was like a really invaluable experience.
All right, great, thank you. So what is the hardest thing, either Dr. Churchwell or Dr. Sinclair Mcbride or both of you, what is the hardest thing about being in your career?
You want to
go first, Dr. Church? You go first.
That's not fair. Okay, fine. You know, that's a good question. I'll be honest with you. I don't think of things being hard or easy. So I have a difficulty in answering the question. Each and every issue that arises, and there are multiple things that come up during the day, I see them more as opportunities, opportunities to acquire knowledge, to convey knowledge, to get a better understanding, to reach an understanding. Because it is the work that actually is important for us to continue to move the ball down the field to obtain to get to our overall objectives and to reach our overall goals. So it's not so much hard. I guess sometimes it's difficult. Sometimes you have difficult conversations. Sometimes and that is part of the limit. You have to be able to speak to people, to actually understand people's viewpoint, to be what we would describe as empathic. You know, you probably have, my wife will tell you at times that I am sometimes wrong, but never in doubt. And because of that, that can actually lead to a bit of conflict. I have to try to avoid that. And as Dr. Mcbride said, take a deep breath. Actually, sometimes close my eyes and work towards that relaxation state so that I can hear better, to see better, so that we can work towards a better way to approach any particular problem. I'm a big believer that just about every problem has a solution, and that there's not so much failure, but there are opportunities for us to learn from everything that we do that actually is going to be able to use it to amplify our opportunity the next time. So I don't think of things actually in difficulty, but more as opportunity. And I'll turn it over.
Yeah, that's a great way to say it, right? That there are challenges to this kind of work. And sometimes challenges can be hard, but you can figure out solutions to get through them. For me, I think one of the things is just that I do so many different types of things. And like part of that is not hard because I've kind of always did that. Like I did music, I did sports, I did dance. Like I've always, like even when I was younger, I always did a lot of different things, but it's hard to divide your time. So I have to be super, super organized to make sure all the different parts of my career get the pieces that I need. And I still have time for my family and myself. The other thing is that being a therapist, you learn a lot of sad things, and lots of hard things happen to people in life. Lots of sad things happen to kids, and it's, you know, that's a lot to hold. So it's important to have space to, you know, have support from peers who are doing similar work, to have time to relax. Like I do yoga on YouTube all the time, for example. But yeah, so just like not holding on to the sadness and knowing that I'm trying to help people and that I'm making an impact, even if hard things do happen in the world.
All right, both. Thank you so much. Our next question. Oh, I'm sorry, I just lost it. What can be done in order to create diversity in a field where historically it has been dominated by one race?
So, I mean, great question. And there is, so that I guess there's a couple of answers to that, and there are a couple of pathways that we need to take to try to work towards a better solution. Number one, from a personal standpoint, you yourself actually thinking about this is something that you want to do, and then mapping out a plan that works towards you developing that unique skill set that's going to position yourself to be able to establish yourself in that particular field. That's the learning that you need, the overall education, the skill set that you would actually need to acquire, and then thinking about the opportunities that should be out there for you to move in that direction. Number two is actually, that's a larger societal issue that we're actually all grappling with almost every single day. Because from a structural standpoint, we have put persistent barriers in place, especially for our African American communities and our Latino communities, of thinking about going into fields that we have very small contributions towards. And how do we break those and work towards decreasing those obstructions, those barriers? One of the things that we have to do from our standpoint as a senior leader is that we have to be I use the word intentional all the time. We have to be thinking every single day, what are the things that we are putting in place that's going to allow those barriers to actually be lowered, and actually people can actually hurdle those barriers to become part of our communities. So that how are we changing the culture of the institutions that we work in, so that these issues become commonplace. These are the things that actually we're working through every single day. Because at the end of the day, culture beats strategy every single time. So if you don't change culture, if people don't understand that diversity itself actually leads to greater capability, enhances any community, enhances any institution, makes an institution greater. If you ask the top 10 companies in this country, in the world, and they ask them, what are the one or two things that are incredibly important to them in terms of making them great? They will tell you diversity. They have figured out diversity is incredibly key, because there's different thought, there's different process, there's different ideas that bubble to the surface that they would have never thought about unless they actually had a diverse workforce, diverse thought, and diverse capability. So that's actually, so there are a lot of different things that we need to do on multiple levels to actually work in that particular direction. But I think at the personal level, there are things that you need to be thinking about that are going to allow you to have the expertise and the capability to jump in when the time is right. And I'll stop there because I'll take too much time. Dr. Mcbride. Okay.
That is the perfect setup, because, you know, working on, you know, you getting into these careers, you getting into these fields, working hard, then there's going to be a community of people who want to support you and lift you up. That's something that's really important to me as a supervisor. And that's why I do a lot of it. Like, I'm so involved in the training stuff, is that if there's, you know, we get 7 interns a year for psychology from all over the country. We usually only a handful of them will be people of color, but I make sure that I check in with them. I'm intentional with them, that they know they have support, that if something's going on, I'm going to go to the mat for them, that sort of thing, because I want more, and then I want to encourage them to figure out ways to stay in our field, in our area, so that we can grow the population we have at Boston Children's Hospital. And it's been fun, because I've been a supervisor for a couple of years now, and I've been successful at recruiting many people to stay at Children's, which has been super fun to kind of grow my network that way. But like, just lean on the support of mentors who will help you do the work, and then we've got your back.
So I have to say we're cutting it close for time, but there is a couple questions that I'd like to kind of condense down, because I think they're really important for, you know, the students to hear. It's, you know, how did you both decide that this was the career choice for you? Did you have any doubts? What advice would you give the students as far as, you know, they're not really sure what they want to do, they're teetering on, maybe I am interested in the health field, I'm not really sure what I want to do. What advice would you give?
So one of the things that I kind of knew for a long time that I wanted to do psychology. Like, I was really interested in working with kids. I was fascinated by the brain. I liked helping people and giving advice. But the thing I realized was, like, the actual, like, touching body parts part wasn't for me. So that's when I realized that there's this whole other field where I don't have to deal with any blood.
That's important.
That I can help people and work at a hospital and be a doctor, but do something slightly different. So I think one of the things that's important to think about is just, like, what do you like? Not just like what subjects you like. What do you like to do with your time? Are you somebody who likes to work in a team? Do you like to write? Do you like to, you know, make YouTube videos, like whatever it is, and see, like, how can I take that and put that in something else? Because, you know, especially with, like, technology and stuff being a part of every career right now, there are ways to take the things that you think are fun and put them into a career.
Yeah, you touched on actually really important points. When I was making a decision to become a physician and ultimately a cardiologist, I thought to myself, what did I like? And my interests were in science and math, and also the interests of that had been instilled in me about how do we actually help people? What is a pathway for me to actually make a positive contribution to the communities that we serve? So medicine became a sort of a natural pathway. Number two, I had lucky. I had right mentors, people I could reach out to see as an example of their overall success, what they had to go through, how they actually, they went around and actually went through barriers. That was my older brother and others. Number three, there are hard times. I mean, organic chemistry is hard. I'm not going to disavow the fact that orgo is hard, and actually still have nightmares of thinking about those particular benzene and those particular issues. But you have to work through those every single day and think about your overarching goal. What are you trying to achieve? And in that, how do you move in that particular direction? And I think it's something Dr. Mcbride said earlier. I think is incredibly important. there is that singular focus, but also you want to be a well-rounded individual. Take the time to actually enjoy music and to enjoy sports and to enjoy your family and enjoy your friends. That's going to make you a better person. It'll make you a better person in the field of your interests, because you'll have that particular skill set of how you deal with people greater, and also to allow you to understand, as people walk through the door, what they have lived through and how to work with them much more effectively.
All right. We're at our time for today. I want to thank Dr. Churchwell and Dr. Sinclair McBride. Everyone in our audience, if you have a moment, please take our survey to provide us feedback. We would greatly appreciate it. Dr. Ruffin, would you like to share some parting words?
Oh, I'm deeply inspired as well, and I couldn't agree more with the doctors stating about being passionate about what you do. I totally agree with that, regardless of what our students choose. And I was inspired by the comments, the questions, and what you have done for our students in Waterbury in encouraging them and supporting them as they make decisions for their career. So thank you for being here. And thank you very much for making this possible through Granville, Judge Mosley and Commissioner Harvey. We really appreciate it.
All right, again, if everyone could please take a moment to complete the survey, it would be appreciated. Thank you all to our schools, our administrators, our parents, families, everyone who attended this symposium. It's such great information, and I know Judge Mosley is looking forward to putting on more of these. Judge Mosley, did you want to share anything, or we're good?
I think we're good. The panelists did a phenomenal job. They motivated me. If I had to do it all over again, I want to be a doctor. Okay. Thank you.
Absolutely. The panelists were wonderful. As I said in the beginning, we have two amazing doctors with us. So thank you both so much. And thank you again to everyone out there. Have a good rest of your day.
Thanks, guys. Happy Friday.
All right, now, take care now.